You pull down your lower lip in the bathroom mirror and something looks different. The gum line around one tooth seems a little lower than it used to. Another area looks redder. Maybe there's a tiny streak of blood in the sink after you brush. None of it hurts enough to feel urgent, so it's easy to tell yourself the same thing many people tell themselves after 50. My gums are just getting older. But age by itself doesn't explain every change you see. And the first warning sign is also one of the easiest to dismiss. Blood that keeps coming back. A little bleeding once can have a simple explanation. You brushed too hard. You used floss after skipping it for a while. You caught the gum at a bad angle. But if your gums bleed repeatedly when you brush or clean between your teeth, especially in the same areas, that's different. One common reason is inflammation caused by plaque collecting around the gum line. The tissue becomes more fragile, so normal brushing or flossing may be enough to make it bleed. That means the blood itself isn't necessarily the problem. It can be a clue that something underneath is irritating the tissue. Here's a useful distinction. If you started cleaning between your teeth again after a long break and the bleeding gradually improves as your routine becomes consistent, that's one situation. If you've been brushing and cleaning carefully and the same spots keep bleeding week after week, that deserves a dental evaluation. And don't respond by attacking the area with more force. Scrubbing harder can irritate the tissue without solving what's happening underneath. Use gentle pressure, angle the bristles toward the gum line, and clean between the teeth consistently. The goal is to remove buildup, not punish the gums. Now look beyond blood and pay attention to shape. Gums normally form a fairly snug border around the teeth. When they become puffy, rounded, unusually red, or tender, that change can be subtle enough that you stop noticing it because you see your own mouth every day. Compare the tissue around neighboring teeth. Does one section look thicker or more swollen? Does flossing there feel sore while the rest of the mouth feels normal? Inflammation can begin before you have real pain, which is exactly why waiting for something to hurt is such a poor warning system. Think of the gum line like the seal around a window. You don't wait until rain is pouring through the wall to care about a seal that has started to swell, separate, or break down. The earlier change is the clue. Your mouth is similar. Redness, puffiness, tenderness, and repeated bleeding are not diagnoses, but they are useful signals that the tissue deserves attention, especially when the change doesn't settle down. And the next sign is one people often miss until the change has been happening for months, because it can happen so slowly that your eyes adjust to it. If this kind of explanation is helping you understand what you're actually seeing in the mirror, subscribe. We break down the oral changes people notice after 40 in plain English without turning every symptom into a scare story. Now look at the length of your teeth. You may stare at a canine or premolar and suddenly think, has that tooth always looked that long? Sometimes the tooth hasn't changed at all. The gum line has moved. When gums pull away from a tooth, more of the tooth or root surface can become exposed. That can make a tooth appear longer, create a small notch or color difference near the gum line, or make cold water suddenly feel sharper than it used to. Recession can have more than one possible contributor. Forceful back and forth brushing can irritate the gum line, and gum disease can also cause the tissues around teeth to recede. That's why simply switching to a softer toothbrush may improve your technique but doesn't automatically answer why the recession happened. Here's something worth doing tonight. Don't just look at your whole smile. Lift your lip and compare similar teeth on the left and right sides. Look at where the pink tissue meets the tooth. Is one side clearly lower? Has a small gap appeared that traps food? Do you see more root surface than you remember? Old photos can sometimes make gradual changes easier to notice, because recession often moves slowly enough that your brain accepts the new appearance as normal. And this is where the phrase, "I'm just getting older," can become misleading. Age can increase the chance that years of habits and oral problems finally become visible, but the calendar itself doesn't explain everything. Years of plaque exposure, tobacco use, medical conditions, changes in brushing habits, and other factors can accumulate over time. Getting older may change the context. It doesn't automatically tell you the cause. There's also one background factor that can quietly make gum problems harder to manage: a mouth that stays dry. Dry mouth isn't something you should simply accept as a normal part of aging. Medications and certain health conditions can reduce saliva, and saliva normally helps moisten the mouth and wash away food particles. When there's less of it, plaque and debris can become harder to control, and irritated tissue may have a tougher environment to deal with. If your mouth feels sticky most days, you wake up needing water, or speaking and swallowing feel noticeably drier than they used to, mention it to your dentist or doctor. Don't stop a medication on your own, and pay attention, because that drier environment can make the next warning sign much easier to hide. The fourth change is harder to see, because part of it can happen below the visible gum line. You may notice food getting stuck in a place where it never used to. Floss may slide into one area differently. You might have a bad taste that returns quickly after brushing, or breath that seems to come back no matter how often you rinse. Those clues can sometimes appear when the space between the gum and tooth becomes deeper and starts collecting more plaque and debris. A dentist measures these spaces with a small periodontal probe because the mirror can't show you what's happening below the edge of the gum. And that matters, because brushing is excellent at cleaning surfaces it can reach, but it doesn't automatically clean every deeper space around a tooth. Think of brushing as cleaning the main streets. The narrow spaces between teeth and the areas just under the gum line are the side streets, and they need their own attention through appropriate cleaning between the teeth and professional care when deeper pockets are present. And this is where people get frustrated. You may already be brushing twice a day. You may already be flossing. You may even rinse after meals. So why does your mouth sometimes still feel like something is off? Part of the answer is that oral health isn't only about what you physically scrub away. The environment inside your mouth matters too. Bacteria naturally live in the mouth, and plaque is a bacterial biofilm. When plaque remains around the gum line, it can contribute to inflammation. That broader oral environment is also one reason some people have become interested in oral probiotics as a complement to their normal routine. One product in that category is Prodentim, a daily oral probiotic supplement designed to support the environment around the teeth and gums. It isn't a replacement for brushing, cleaning between your teeth, professional cleanings, or seeing a dentist when you have warning signs. But if you feel like you're already doing the obvious things and you're curious about supporting your oral routine from another angle, I've put information about Prodentim in the description below. Click the link after this video, look at the details for yourself, and decide whether it makes sense for you. Now, because bacteria and inflammation are only part of the picture, there's one more change you should never casually write off as age. And this is the one that can tell you the support around a tooth may already be changing. Put your teeth together gently and notice whether your bite feels the same. Then, with clean hands, pay attention to whether any permanent tooth feels looser than the others. A tooth that starts shifting, a new space opening between teeth, or a bite that suddenly feels different can mean the supporting structures around the tooth have changed. This is where gum disease stops being only a story about the pink tissue you can see. Teeth are held in place by a system that includes gum tissue, connective fibers, and bone. When that support is damaged, a tooth can eventually loosen or move. That doesn't mean every new gap or bite change is caused by gum disease. Teeth can shift for other reasons too. But a loose adult tooth, especially when it appears with bleeding, swelling, recession, pain when chewing, or persistent bad breath, deserves professional attention. And here's what makes this fifth sign so easy to underestimate. People often judge gum health by pain. If nothing hurts, they assume nothing serious is happening. But changes around the teeth can develop gradually and with surprisingly little discomfort. A tooth may feel perfectly calm while the tissue around it has been changing slowly. So the absence of pain should never be used as proof that everything is fine. If a tooth feels loose, if you see pus near the gum line, if swelling persists, or if chewing becomes painful, have it evaluated rather than trying to cover the warning sign with stronger mouthwash or harder brushing. Here's a simple way to check yourself without turning your bathroom mirror into a diagnostic tool. Ask 5 questions. Do my gums bleed repeatedly? Do any areas look red, puffy, or tender? Do any teeth look longer than they used to? Am I suddenly trapping food or dealing with a bad taste or bad breath that keeps returning? And has any tooth started to feel loose, shift position, or change the way my bite comes together? You don't need 5 yeses for the answer to matter. A persistent change in just one area can be enough reason to bring it up with a dental professional. And notice what all 5 changes have in common. None of them are about how white your teeth look. None can be judged by whether your mouth feels fresh for 20 minutes after mouthwash. They're changes in the tissue and support system around the teeth. That's the part people miss when oral care becomes a routine of brushing faster, rinsing harder, and assuming that no pain means no problem. If you've noticed one of these changes yourself, tell me in the comments which of the 5 showed up first. Repeated bleeding, puffiness or redness, recession, food trapping, or persistent bad breath, or a tooth that started to shift. That answer can help other people realize just how subtle the first warning sign can be. The bigger lesson after 50 isn't that your gums are destined to fail. It's that small changes deserve context. Bleeding that keeps returning, a gum line that is slowly moving, swelling that doesn't settle, new spaces trapping food, or a tooth beginning to shift can all tell you something has changed before the problem becomes impossible to ignore. So the next time you're brushing, don't just look at your teeth. Look at the gum line and ask one simple question. What looks different from 6 months ago? Pay attention to changes that persist and bring them up at your next dental visit or sooner if they're getting worse. Your gums often whisper before your teeth force you to listen.